back to our channel. My name is Holly Cohen. I am with Preferred Medicare Plans. I'm one of the co-founders. I've been a licensed agent for over 10 years, and I want to share with you some secrets I have learned about Medicare. I want to share them with you. So the topic today is an updated version of what is the difference between a Medicare Supplement plan versus a Medicare Advantage plan. Let's get right to it, shall we? So when you start on Medicare, there are two ways to be on Medicare. There's Medicare Supplement, and then there's Medicare Advantage. What's the difference? Let's start with Medicare Supplement. When you're on a Medicare Supplement plan, you are on Original Medicare. Original Medicare is the program that started back in 1966. And as I say to every client, it's our best program we've had. It has been in existence in our healthcare system since 1966. It has not changed very much, and it is what we pay into while we are in our working years. So we are paying into Medicare, which is the Original Medicare program. There are two parts to Original Medicare. There is Part A, which is the hospital, and there is Part B, which is the outpatient or also medical side of Medicare. Original Medicare will pay for anything that is medically necessary, which means anything that your doctor has ordered for you to do, surgery or testing, lab work, you name it, whatever your doctor has ordered, Medicare will pay for it at 80% as long as it is, again, medically necessary. So pretty much everything that your doctor orders, Medicare will pay at 80%. Original Medicare is accepted all over the United States. Almost every doctor and every hospital within the whole US does accept your red, white, and blue Original Medicare card. That is the program that we all believe that we are on once we start Medicare. Usually most people do start at 65, unless they do retire later in life, then they might start Medicare a little later. Some people also do go on Medicare early for disability, but we are just talking about starting Medicare after 65. So Medicare Supplement is what works with Original Medicare, A and B. Original Medicare only pays the 80%. So the question is, what do we fill in that gap, that 20% with? And that would be a Medicare Supplement plan, also known as, AKA, a Medigap plan. Okay, so Medicare Supplement equals Medigap. Those are the exact same thing. If you are surfing on the internet, you will see both terms. They do mean the exact same thing. So a Medicare Supplement or / Medigap plan does fill in the gap. Plan G is the most popular plan at this time. It is the one that fills in the entire 20% after you meet a very small Medicare Part B deductible, which this year equals $203. So if you're on a Medicare Supplement plan, that means you have Original Medicare, you have Plan G, and then you will also, in that circumstance, Original Medicare Plan G, also have a standalone prescription plan called Part D, as in drug, which is covered in another video. But Medicare Supplement is your Medicare A and your Medicare B, which are your red, white, and blue cards, and then a Supplement plan or Medigap plan, most popular at this time, is Plan G. Again, you meet your deductible, $203. Once you have met that, every other medical bill that your doctor has ordered will be covered 80% first by Medicare, and then Medicare will bill that remaining balance, that 20%, to whomever you have your Plan G with, whatever insurance company. A Plan G, a Medicare Supplement plan, AKA Medigap Plan G, is equal from one carrier to another. It is standardized by Medicare. It is an extension of your Original Medicare, meaning your doctors will bill Medicare. your hospitals will bill Medicare. Medicare will pay back those doctors and pay back those hospitals at 80%, and that 20% is filled in by your Medigap Medicare Supplement Plan G. And again, you will just have to meet that one time per year Part B deductible, which equals $203. Once you have reached that, every single bill is paid for. There are no co-pays when you visit your doctor if you're on a Medigap Plan G. And you do have a monthly premium to pay for your Plan G. That is something that is in addition to your Medicare premium. Your Medicare premium is $148.50 this year. And then your Plan G can vary in cost depending on which insurance company that you choose. The insurance company that you choose doesn't matter very much. Your doctor could care less if your card says Snoopy on it, Plan G. It doesn't matter. Your doctor will take your red, white, and blue Medicare card. Your doctor will bill Medicare, and it's Medicare that will then submit the 20% to whomever you have your Plan G with. That is part of the complex situation that people find themselves in as far as confusing parts of Medicare. Medicare, when you're on original Medicare and you have a Medicare Supplement / Medigap plan also, AKA Plan G, original doctors and hospitals will bill original Medicare, and it does not matter to your doctor or your hospital which insurance company that you have. There are no networks with original Medicare Plan G. And again, you have that standalone prescription plan. Now, let's compare and contrast that with what Medicare Advantage is. Okay, Medicare Advantage is not original Medicare. It is a replacement. It is a substitute for your red, white, and blue Medicare card. When you're on a Medicare Advantage plan, you are only on a private insurance company health insurance program, similar to how you are accustomed to understanding insurance. It is a complete takeover of your original Medicare. You still continue to pay your Part B premium of $148.50, but you actually are turning over your original Medicare to a private insurance company, AKA the privatization of Medicare, if you've ever heard that term. That's what Medicare Advantage is. Medicare Advantage is also known as, AKA, Medicare Part C, as in Charlie. So again, let's recap. Medicare Advantage is a replacement. It is a substitute for original Medicare. You still pay your $148.50 per year for your Part B premium. However, a Medicare Advantage plan program takes over your Medicare completely. So let me walk you through a real life scenario. If you're on a Medicare Advantage plan, this is typically how it would go. You walk into your doctor's office, they ask, what do you have for your insurance? You would answer back, I have whatever the name of the insurance company is, Medicare Advantage, PPO or HMO, and I will go over that in a moment. So you hand that one card to your doctor. They would then bill that insurance company directly. They would not ever bill Medicare, because remember, if you're on a Medicare Advantage plan, you have turned over Medicare, your original Medicare, to a Medicare Advantage plan insurance company to manage everything for you. So therefore, when you're at your doctor's office and they're billing your insurance, they're actually, if you're on Medicare Advantage, they are billing an insurance company. And Medicare has no idea really what you have even had, what you did at the doctor's office, because they're not being billed. So it's Medicare Advantage, where you do have networks. Let's talk about that for a moment. You have a PPO or you have an HMO network. On Medicare Advantage, it is very important that you know if your doctor or your hospital is in their network or not. If it is in network, you're going to have a max out of pocket that this year the federal government has the highest max out of pocket, and Medicare Advantage plan insurance company will the max out of pocket amount is $7,550 this year. That's in network. If you have a PPO, the maximum out of pocket out of network is $11,000 per year. That's those are this year's numbers. So it's quite high, as you can see. So there are some disadvantages to a Medicare Advantage plan that you really need to look out for if you are going on that route. Remember, let's recap. 2 routes, 2 ways to be on Medicare. Original Medicare with a Medicare Supplement plan and a Part D. That's one way. And in that situation, when you keep your original Medicare intact and you have a Plan G, the Part D again is separate, and you will have your monthly premium of your $148.50 from Medicare, and then also you will have an additional premium for your Plan G. Most states, it's not so bad. So, and excellent coverage, because remember, Plan G will pay 20% of every single bill you'll ever have. Medicare will pay the first 80%, your Plan G will fill in the 20%. Your only out-of-pocket cost for the whole year is $203. Once you have hit that, you are completely 100% covered. You have no other medical bills. Medicare will also send you a quarterly statement showing you how much you have, where your billing is with your doctors or your hospitals, and it will also show you in that quarterly statement that once you have met, it will display once you have met your $203 deductible for Medicare. So that's a Medicare Supplement plan. It is the most financially sound, the most cost-effective. I always tell everyone, if you can afford a Plan G plan, if you can afford one, you have the best of everything. You can go to any doctor you want. You can go to any hospital, any hospital in the whole United States that you want to see. Anything that your doctor orders, it is covered completely, first by Medicare at 80%, and then the remaining balance, 20%, filled in by your Plan G. That is an excellent way to be on Medicare. The other way to be on Medicare Advantage, is, again, it is a replacement for Medicare. Many times those plans have a very low monthly premium, or they have 0 monthly premium, and you're only paying your $148.50. However, Medicare Advantage, this is where you need to be so incredibly careful. And every commercial, almost every single television commercial you'll see on television about Medicare is talking about Medicare Advantage. So just be very careful. Remember, it is a replacement, a substitute for original Medicare. Remember, Medicare Advantage, there are PPO or HMO networks. Remember, there is a maximum out-of-pocket amount this year, which the government has capped it at $7,550 in network, $11,000 out of network. So free is not free on Medicare Advantage. So when you watch the commercials, be really careful. We do both in our agency. I can explain either way for you so that you understand and help you figure out what's your best way. Here to help, here to educate, and always feel free to give me a call, 855-265-6334. Again, my name is Holly Cohen. I'm with Preferred Medicare Plans. My channel is Medicare Secrets. The great team. We're always going to be able to help you year after year after year understand the changes or any new happenings with Medicare as you go throughout the years. Here to help, and again, 855-265-6334. Talk to you soon. Bye-bye.